We look at patient journeys as a continuum. So a patient will start their journey maybe exploring therapy options or trying to understand their disease state, and ultimately will become a patient of a therapy or multiple therapies over time. In working with Salesforce across their clouds, there's an opportunity to understand that patient from the beginning of that journey all the way through their care. So if you think about a patient when they initiate a care journey, we might use Marketing Cloud to identify patients that are exploring options to treat their disease or trying to better understand their disease. And we can offer support and services that are related to that early point in their exploration. As a patient begins to take therapy or undergo treatment, we want to have much more specific engagement around healthcare interactions, and we need to use the capabilities of Health Cloud to ensure that we're protecting patient data, that we're using that data appropriately to provide services related to the patient's care, as opposed to the marketing or more informational services we've provided earlier. And then as that patient maybe moves into a state where they're done with their care or where they have a remission and they're in a different part of their journey, we may continue to engage them with communities or portals or other ways in which we can provide ongoing information to help them live a lifestyle that can create more longevity and help them move on from that disease journey, or at least continue with that disease journey in a way that's better supported and cared for. And Salesforce has really been helping us enable that by creating cross-cloud opportunities and leveraging abilities of their clouds in different ways to create those journeys that do cross across the ecosystem, and also by creating ecosystem alliances with their partners that we're allowed to leverage as Deloitte. With Apple, for example, they announced a little while ago relationships they have with AWS or Google. Creates a really good way for us to think about the patient holistically, the journey and the experience, and help them navigate their disease, not just a specific interaction. We think it's very important to understand what part of the journey the patient's in, and certainly there's regulatory reasons as well as just good engagement reasons to think about that. When we're helping patients identify the types of care they might receive or explore disease and therapy and treatment options, those engagements are a little less structured, right? They might be exploratory in nature, the patient might be looking for information or data, and those tend to align very well with Marketing Cloud journeys. So while we're not exactly marketing, we are having those types of engagements that feel very much like an early marketing relationship. When a patient is identified as a patient, is on therapy and is seeking services, that's really where we need to create that dividing line, where we need to understand we're no longer in a free-form sort of relationship that we might have in early exploration. We're much more in a structured medical healthcare relationship, and we need to make sure all the data sets are protected. We need to make sure the person feels comfortable engaging with us, and we need to make sure we're not crossing any of those boundaries where we are entering into marketing activities that we shouldn't be doing when we're treating a patient, taking care of them. And that's really a Health Cloud journey for our customers. That's a patient in care, receiving care, protection of that healthcare information, integration with other healthcare information data sources like EMRs and patient records, and that secure patient journey moves us into Health Cloud and the other tools on that side. So we're able to define that line and then use the Salesforce clouds to help us treat the person we're engaging with appropriately depending on what part of the journey they're in.